I'm a naturopathic doctor who's been helping people get to the root cause of their symptoms for 20 years. And here's what surprises me. Most women can only name about 5 of them. So if you've been told your labs are normal, you're too young, or it's probably stress, you may be missing the real reason you feel completely different lately. Let's talk about some of the symptoms nobody warns you about. Most people expect hot flashes. That's the celebrity symptom. It gets all the attention. But what about the woman who suddenly can't remember why she walked into a room? One of my patients, Michelle, came in convinced she was developing a serious memory problem. She'd lose her train of thought mid-sentence. She would forget names, forget appointments, forget where she put her phone. She thought something was seriously wrong, but it wasn't, because it was perimenopause. Then there was Sarah. She wasn't worried about brain fog. She was worried she was becoming an anxious person. Out of nowhere, she'd get heart palpitations, wake up at 3 a.m. and spend the rest of the night staring at the ceiling, negotiating with her own thoughts. You know, the kind of conversation that somehow seems reasonable at 3 a.m. and ridiculous by breakfast. Again, perimenopause. And then there's a symptom that causes a lot of confusion, which is weight gain. One patient told me, I'm eating the same things I've always eaten. I said, that's exactly why you're confused, because sometimes the body changes the rules without sending out the updated handbook. What worked for years suddenly doesn't work anymore. And yes, hormones can absolutely be part of that story. What's important to understand here is that perimenopause doesn't always announce itself with a hot flash and a giant flashing sign. Sometimes it just shows up as brain fog, anxiety, poor sleep, mood changes, joint aches, heart palpitations, low motivation, or even feeling like you've somehow become a completely different person in the last year. The good news, you're not imagining it. You're not lazy. You're not losing your mind. And just because your lab work came back normal doesn't automatically mean your hormones aren't involved. The first step is recognizing the signs. The second is to test your hormones. I love the urine Dutch test. It's a comprehensive way to better understand what your hormones are doing in your body and why. It reveals a lot more than what we can see in blood work alone. Once you understand what's actually happening, you can stop blaming yourself for symptoms that may have had an explanation all along. And if you're curious to learn more about hormones, check out this next video.